chapalawellness.com.
I'm Sophie Hawkins, and I have a clinic here in Ayurveda where I offer Thai massage, Ayurvedic massage, and I have a specialty called the Hesch method, and that realigns the skeletal system to promote healthy movement of the joints, and it treats muscle and joint pain that has definitely plagued me for many years, and I had no other answer to it until I found the Hesch method, and that's what got me into that work. So that's what I do here in Ayurveda, and I've been here for about 2.5 years now. And I'm right downtown Central, 1 block west of the main square on Hidalgo, and I have treated both people English, and with the help of iTranslate, I've also seen some clients that speak Spanish as well, so working on that, but yeah.
And I imagine with any kind of energy healing and healing of this type, it's pretty universal anyway. You know, you're not really needing to speak to people because you're able to feel what's going on within the body.
Yeah, with the Hesch method, it's very mechanical. We're spring testing every joint in the bodies. We usually start at the pelvis and then go down the legs to the feet, but also up the spine, right up into the jaw. We want to make sure every bone in the body is able to, is in its proper place and is moving properly. So with the Hesch method, we rely totally on spring testing. If I have spring all through the body, then there's nothing I can treat with that Hesch method. So often in a Thai massage or an Ayurvedic massage, I'll do a mini Hesch assessment to just rule out that person as someone that could be helped by the Hesch method. So if I do find a misalignment, and sometimes I can treat it right during a massage because it's something very simple. Maybe it just involves a couple of the Hesch treatments, and everything's moving a lot better. And then we can do a massage and that at the same time. So when that happens, that's excellent. I can help that person out a lot in that one session. But if there are other things involved that's going to take more time to straighten out in terms of and restore proper movement, sometimes it takes a couple hours and I need to see the person one other time. So then we're into the Hesch method, and we need to schedule those 2 appointments. And then I like to do a follow-up a couple weeks down the road after we do the first 2 treatments, just to make sure everything's going as it should, and if the person has any other issues that we might be able to help through that method.
Yeah.
So as long as there's not a lot of wear and tear in the joint, or there's there are injuries that happen that we're just not going to be able to get a bone to move like it should. So then we have to work around how can we best help this person to get as much function out of their body, good mobility, with that method.
Yeah.
And so some people are a candidate for the Hesch treatment, and every once in a while I see someone who comes in and everything's springing really lovely, and they're coming in more for the experience of like a Thai massage or an Ayurvedic massage and the health benefits that come from that. But I would say the bulk of my work here has been treating people with those misalignments that even like a massage, it might make you feel better for a little while, but it's never going to fix what the problem is, because you have to actually move that bone. And the nice thing about the Hesch method is that it's not because we're working with the body, doing what the body wants to do to move it back into a better alignment. We're not doing any very like forceful thrusts, or we're not forcing anything. And in fact, if you have pain during a Hesch treatment, it's we pay a lot of attention to that and say something's not quite right here.
Yeah.
Either we need to treat something else, or we need to, before we do this one treatment, there's something else that needs to be treated. So we're always paying attention to that. It shouldn't be a painful experience.
Yeah.
Yeah.
Now, as a majority of the people that come to see you, do you find, certainly with myself, when I've been to see you, the problem was in the hips? And do you find that the majority of people, the misalignments start from the hips?
Yeah, usually, even if, even spraining an ankle, going over on an ankle, there's the possibility of shifting a couple bones in your feet. And that eventually will work up into the knee and up into the hip. So when the bones, whether the injury started at the foot or was more of a whole body impact, or a fall, or an ongoing asymmetrical position that you keep your body in, or an asymmetrical a sport that you play like golf, something like that, where you're going all one way. Anything like that, it can contribute or cause a misalignment. And what was your question again?
No, it was more about the hips, because I know with myself it was the side glide.
Yeah.
It was the hips being out of place, and that seemed to cause
Yeah.
not only problems for me with my shoulders, but also problems with my legs as well.
Exactly, yeah. So, I think why sometimes the hips become the apex of everything is because it is the motivator of movement. The movement of the pelvis is what makes your legs actually move.
Yeah.
So when there's a problem there, or even when the problem starts down below, it can end up there, and that's where everything gets kind of locked up.
Yeah.
So when we find a misalignment in the pelvis, as a Hesch practitioner, we can treat that, fix it, and so then we have proper movement of the bones.
Yeah.
Now, if someone's been in a particular misalignment for a long time, they might have gotten tighter on one side and more strain on the other side, and so we're looking at a bit of physio too, most likely, in some cases.
Yeah.
In other cases, it's surprising to me, the people that I treat down here that are more mature, and yet the treatment's been very, very successful and helpful to them. So yeah, and it's a one-time thing. It's not like you keep coming back.
Yeah.
So that, I think that's pretty wonderful too.
And that's it for myself. You know, it's been from a teenager right the way through my life. In England it was only the prospect of surgery. In Canada, I thought I'd found the solution through chiropractors. And it was only until I met you and we did the Hesch therapy that we come up with a solution that actually fixed and put the problems I had and made them go away. And it seemed too simple to be true. And are you finding that a lot of people have been through many different modalities of treatment, and then when they come to you with the Hesch therapy, that's the game changer for them?
It certainly can be. If the issue is a misalignment issue, that's what we treat. So I know there's lots of people who've gotten help with other modalities, and if I can't find a misalignment, the person still has pain, I don't have anything to offer, then I'm going to look to Ayurveda, something internally, and I'll offer whatever I can there in terms of that knowledge as well. But yeah, if it's a misalignment that's causing the issue, it can be like night and day.
Yeah.
And that's how it was for me. And that's why I do this work, because I'm sure that I would be on a list for a hip replacement now.
Yeah.
If I hadn't found the Hesch method when I did, and I went looking for something to help myself, because all of the things I was trying wasn't fixing what was happening with me. And I was seeing the same patterns in my clients, that my Thai massage clients, you know, when you're doing Thai massage, you're working on a mat on the floor. And so you're standing above someone, and so you can see how is someone aligned, you know, very clearly. And I could see the same patterns in my clients that I was feeling and seeing in myself, and until I found Jerry Hesch on YouTube, I really didn't have any idea how to help them or myself, and it was very dramatic for me, like it is for a lot of my clients, and that's a wonderful thing.
Yeah.
And almost always there are contraindications for the Hesch method. If there's so much damage that we don't want to even shift things because we don't know what's going to happen. So there are those situations, but I have found mostly, I would say 95% of the time, it's going to be helpful.
Yeah.
And the other 5%, we're looking at, you know, you're going to have to be willing to change your diet, change your, you know, other things.
There's a lot more external factors that are in play.
There are a lot of factors to health, but if you have a joint muscle pain that hasn't resolved through a lot of other treatments, or you have to keep going back, it's definitely worth a try to at least come in for an assessment.
Yeah, and would I be right in thinking that the majority of the people that come to you is via referral, because one client has had a treatment and it's, again, you know, I can only testify from myself, it's been a game changer, it's the first time in my life I've felt good and healthy and everything's in place.
That's great.
And I've referred people to you, but would the majority of people that you see are all by referral?
It's not all by referral, but it's a lot.
Yeah.
I was busy. I was booked up to a reasonable weekly amount within a couple weeks of being here in Ahihi.
Yeah.
And that was partly because I have a great location.
Yeah.
People could see my sign, but also I helped a couple people in the first week that I was open that hadn't gotten help other places. They were, and so it went from there. Yeah, it's been a lot of word of mouth.
No, it is. It's really an incredible therapy. So if people want to get in touch with you and find out where you are, what's the best way to contact you?
The best way is on WhatsApp. So my sign is right out front. My website, www, I guess we don't have to say that anymore. I can stop.
No.
Sophie-Hawkins.com. So email and WhatsApp is the best. If you call me, most of the time my phone is off. I'm with clients, or I forget to turn it back on. I'm just not a cell phone answer. I won't be answering the phone much.
Yeah.
So
no, that's fine.
Yeah, WhatsApp and email are the best.
No, that's great. I always manage to get in touch with you. I know you always get back to me within a day whenever I send a message.
Yeah.
And of course, if you're watching this video now, you're probably looking at the image of the website and the contact details for you to store down. And of course, this video is linked directly through to chapalawellness.com, where you're going to find the bio for Sophie, as well as her contact details, contact number there. So let's hope it works out for everyone, and people can find you, and people can start making a difference in their lives. Thanks very much, Sophie. It's great to talk to you.
Always good to talk to you, Chris. Thank you very much.